Okay, so let's unpack something huge, something really beautiful, but also, let's be honest, something that can feel incredibly overwhelming, bringing a brand new baby home, especially if it's your first time, zeroing in specifically on feeding, and pull out the absolute best, most practical, sometimes kind of surprising nuggets to help you feel a little more prepared for these intense first few days.
Exactly. We're sifting through those initial days of breastfeeding, the practical stuff, the emotions, the biology, to give you the essential understanding. The goal is really just to help you make sense of what to expect and what really matters in that intense beginning.
Right. So let's dive right in at the very, very beginning, that incredible moment right after birth. Something quite special happening then, often called the magic hour. What exactly is this magic hour, and why is it highlighted as, like, so incredibly significant for getting breastfeeding off the ground?
Yeah, it really emphasizes trying to initiate breastfeeding right away, the first 60 minutes after birth.
Okay.
And this isn't just about an early snuggle, although that's vital too, obviously.
Yeah.
The act of the baby latching and starting that rhythmic sucking action in this window literally begins to activate the cells in the parent's breasts that are responsible for milk production. It's like flipping the biological switch for your supply.
So it's not just a nice to-do, it's the actual starting gun for your body's milk production process.
Postponing non-urgent tasks like, routine weighing or dressing the baby during that first hour.
Right.
Instead, the focus is all on relaxed cuddles and lots of skin-to-skin contact between parent and baby. This contact is just so powerful because it triggers the release of oxytocin in both of you. You might know oxytocin as the love hormone, but it's also essential for your body to release that first milk, the colostrum.
That connection makes perfect sense. Skin to skin, love hormone, getting the milk flowing. But the surprising double duty for this early feeding, right? How the baby's feeding actually helps the birthing parent recover.
Yes, and this is a really remarkable biological insight that often gets, overlooked. As the baby breastfeeds, the oxytocin released causes the parent's uterus to contract.
Okay.
In those first hours after birth, this contraction is crucial for naturally expelling the placenta and significantly helps reduce blood loss. It's this amazing sort of built-in synergy where the baby's action directly aids the parent's physical recovery.
Wow. But of course, births don't always go exactly as planned. What if there's a C-section or, other complications that prevent that immediate magic hour feed?
Yeah, that's a really important question. Even with a C-section or complications, skin-to-skin contact and attempting an early feed might still be possible, even if it's a little delayed.
Okay.
If the baby can't breastfeed right away, strongly recommend starting to express milk early and frequently.
Expressing, meaning either hand expressing or using a pump.
Exactly. Hand expressing or using a hospital-grade pump helps initiate that milk supply and allows you to collect that first milk, the colostrum.
Right, because it's packed with good stuff.
Absolutely. Dense nutrients and protective properties.
Okay, so once the baby is ready and able, let's move on to the mechanics. Here's where it gets really interesting and often feels a bit tricky. Latch. Why is getting a good attachment so fundamental right from the start?
Good latch directly impacts how effectively the baby can transfer milk, which obviously affects their growth. But perhaps even more immediately important for the birthing parent, a poor latch is identified as a major cause of sore or damaged nipples.
Ouch. Yeah. So getting the latch right is vital for comfort as well as making sure the baby is feeding efficiently. How does the information describe achieving a good latch?
Aim the nipple towards the roof of the baby's mouth. The goal isn't just getting the nipple in the baby's mouth, but for them to take in some of the areola beneath it as well. That's the darker area around the nipple.
Okay, so get more in there.
Exactly. This allows them to draw both the nipple and breast tissue deep into their mouth, creating a seal that enables them to feed effectively. And here's some incredibly practical advice. Never hesitate to ask a healthcare professional to check your latch. Even if it looks fine or someone has told you it is, getting it checked, especially while you're still in the hospital or birthing facility, is highly recommended.
That feels like confidence-boosting advice. Get expert eyes on it early. Now, let's talk about the rhythm of feeding in that first week. A lot of variability in frequency and duration. For a new parent, how confusing can this variability be?
Oh, it can be incredibly confusing. The first 24 hours are particularly variable. Some babies might sleep a lot after the, exertion of birth.
Right.
Others will want to feed frequently. This lack of predictability is one of the most common sources of anxiety, often compounded by conflicting advice new parents receive. The clear message here is that each mother and baby pair is unique.
Yeah.
Individuals, and their pattern might look different from someone else's.
And in those first couple of days, they aren't getting huge volumes, right? It's that nutrient-dense colostrum.
Exactly. Colostrum is thicker and produced in smaller amounts than mature milk, but it's incredibly concentrated. Beyond its nutritional value, it helps the baby practice the complex coordination needed to suck, swallow, and breathe while feeding.
Ah, like practice runs.
Kind of, yeah. Before the milk volume significantly increases. Then by around days 2 to 4, when the main milk comes in, feeding becomes much more frequent.
How frequent are we talking? Like really frequent?
Your baby will likely want to nurse 8 to 12 times every 24 hours, and sometimes even more.
Wow.
Yes, that absolutely includes overnight.
Okay. Wow. And the feeds themselves can initially take a while.
They can, yeah, especially in those early days. Early feeds can range anywhere from 10 to 15 minutes up to 45 minutes, or even an hour sometime.
An hour.
This is because the baby is just developing the muscles and coordination required for efficient milk transfer.
It's very intense at first, often more intense than you imagine it would be. That level of intensity, that constant feeding, it can be a real shock, leaving very little time for anything else, right?
It absolutely can be a surprise. And the new parents might struggle to find time for basic things like, eating or showering.
Yeah.
However, the crucial reason behind this intensity.
Which is the supply building, that connection again.
Precisely. That frequent feeding is the primary mechanism for initiating and building your milk supply. The core principle is simple. The more your baby feeds, the more milk you'll make.
Makes sense.
Which brings up an important point that causes a lot of confusion. With all this feeding, should you try to get the baby onto a feeding schedule?
The advice is quite clear on this. Don't try to plan a rigid newborn feeding schedule. It explicitly states that attempting to schedule feeds might actually reduce the opportunities for feeding.
Right.
Instead, the focus should be entirely on recognizing and responding to the baby's hunger cues.
It starts with subtle signs. Stirring from sleep, opening their eyes, turning their head when you gently stroke their cheek.
Okay.
Poking their tongue out, making little cooing sounds,
Yep.
sucking their lips, trying to eat their hand.
The hand eating. Yeah.
And then finally, crying is the obvious one. But crying is actually a late sign of hunger.
Okay, so don't wait for the crying.
Ideally, no. If you're unsure, just offer the breast. You can't overfeed a breastfed baby. It can be harder to get a good latch once a baby is already upset and crying, especially in these early learning stages.
That makes sense.
And there's reassurance, too. As the baby gets older, they usually become faster and more efficient feeders, and the feeds often become less frequent, making it feel much more manageable.
That promise that it won't always be quite this relentless is definitely a relief. Let's turn to some common physical challenges mentioned. Breastfeeding shouldn't hurt, but many new moms find the first few days uncomfortable or even painful. What's behind that apparent contradiction?
Yeah, that can seem confusing. The material explains that while pain isn't normal or expected long-term, initial discomfort is very common because your nipples are simply not accustomed to the strong, frequent sucking action.
You're right, they're getting a workout.
Exactly. It uses a relatable analogy. It's like wearing a pair of stiff, new shoes. If your baby isn't latched properly, or if they're comfort sucking for very extended periods with a poor latch, it can definitely damage your nipples.
So preventing damage is key. What does the information recommend if pain continues beyond that initial few days of adjustment?
It's clear that prevention is better than treatment. If pain persists after those first few days, the strong advice is to seek help from a lactation consultant or breastfeeding specialist. That suggests pain isn't something you just have to, push through long term.
Okay, good to know. Are there other physical sensations besides nipple discomfort?
Yes, you might experience period-like cramps, sometimes called after pains, after feeding sessions in the first few days.
Right.
This can be particularly noticeable if it's not your first baby.
And what causes those after pains? Is it related?
It is. It's that same busy hormone, again, oxytocin.
Of course.
As well as releasing milk, it helps your womb continue to contract back down to its usual size after birth.
Fascinating how one hormone does so much. The information also talks about engorgement when your milk comes in. What does that typically feel like?
The breasts becoming full, firm, and larger. Some women find them getting quite swollen, hard, and tender. That's engorgement, which happens as your milk volume increases.
Okay.
Frequent feeding is the best way to help relieve that pressure and discomfort. Keep things moving.
Keep things moving. Got it. Okay, one of the biggest sources of worry for new parents, I think, is wondering, is the baby actually getting enough milk?
Yeah.
Especially in those first few days when it feels like they're feeding constantly, but maybe not getting huge amounts yet.
Oh, absolutely. This concern is completely understandable. If you are consistently feeding on demand whenever your baby shows cues, your body should be producing the milk your baby needs.
Okay.
It then provides the most practical, day-to-day way to check by keeping track of wet and dirty diapers.
So, counting diapers is the method. What patterns should parents be looking for in those first days?
Nearly all babies are back up to their birth weight by day 10 to 14.
Okay.
An expected weight gain, an average of about 150 grams per week in the first 3 to 4 months, but growth can vary from week to week. The important point is that healthcare professionals look at the baby's overall well-being and growth trajectory continuously, not just one way in.
That broader assessment is key.
Mhm.
Right. Let's look at another specific bodily process, the letdown reflex. What is this and what triggers it?
The letdown is basically what causes the milk to flow freely during a feed. It's a reflex triggered by the baby's rapid sucking at the start of a feed, stimulating the nipple. This signal travels to the brain, which then releases oxytocin. Yes, that busy hormone again.
The love hormone, the recovery hormone, and the milk flow hormone. It does everything.
It really does. That oxytocin travels through the bloodstream and causes tiny muscles around the milk-making glands in the breast to contract. Simultaneously, it dilates the ducts the milk travels through. This combination is what pushes the milk out, allowing it to flow freely for the baby to drink.
So what happens if that letdown reflex is inhibited or doesn't happen properly? Does the milk just not come out?
The material indicates that, the milk won't flow because it's a hormonal reflex mediated by oxytocin. Anything that interferes with oxytocin release can hinder it. Stress, for example, is noted as something that can stop or make the letdown difficult.
Which brings us back to the importance of that supported, comfortable environment during feeds that the material mentions. Makes total sense.
Precisely. Feeling supported and comfortable is crucial not just for bonding, but for the efficient biological process of milk transfer itself.
The information offers a lot of perspective and hope, which is great. It acknowledges that while this early phase feels incredibly relentless, it also describes it as short and special, and it promises that things will settle down and get easier.
It absolutely does provide that light at the end of the tunnel, painting a picture of what positive changes you can typically expect by the end of the first month. By then, your milk supply should be well established, your baby will be stronger and more efficient at feeding.
Good.
Any initial latch issues should hopefully be sorted, your body will be more efficient at making milk, and common discomforts like soreness or leaking should start to subside.
That sounds like a major turning point to look forward to. Finally, and this is incredibly important practical advice, when should you seek professional medical help?
You should seek medical advice quickly for potential dehydration, dark-colored urine, no poos for more than 24 hours, a sunken fontanelle that's the soft spot on the top of the baby's head, jaundice, lethargy, or floppiness, and crucially, not wanting to feed, specified as going 4 to 6 hours or more without a feed.
Okay, that's a really clear list. And other red flags.
In the first 3 or 4 weeks, babies generally feed frequently and sleep a lot. If your baby is consistently unsettled and wants to feed all the time, beyond that normal newborn frequency, that's a reason to check in with a healthcare professional.
Right, like nonstop feeding could be a sign something's up. What about vomiting? Is that always a concern, especially in the early days?
Good question. Bringing up milk-colored vomit after a feed isn't usually a cause for concern. Happens a lot. However, you should definitely see a healthcare professional if the vomit contains anything that looks orange, red, green, brown, or black.
Okay.
Or if the baby is projectile vomiting forcibly.
Gotcha. Any other critical signs to watch out for?
Yes. Also seek help if your baby has a high temperature, blood in their poo, a sunken fontanelle, or is not back up to their birth weight by 2 weeks of age.
Right.
If none of these concerning signs are present and your baby is otherwise meeting their growth targets, they are very likely getting enough milk. And remember, you both are learning, you will get used to it and settle into a pattern together.
So we've really gone on a journey through this information starting right from that incredible first hour and its biological triggers, understanding the mechanics of latch and the intensity of those early feeding patterns, acknowledging and navigating common discomforts like engorgement and soreness, getting practical ways to check if the baby's getting enough, exploring the science of the letdown reflex, and holding on to the promise that things do get easier while having a clear map of when to seek help.
It truly covers the essential landscape of that first intense week, acknowledging the challenges but grounding everything and practical, biologically based insights from the information provided.
It paints such a vivid picture of this foundational time. It really does.
Yeah, and what's truly fascinating to reflect on from all this information is the profound natural partnership at play from the very beginning. Consider that intertwined biological feedback loop we discussed, how the baby's simple actions of latching and sucking immediately influence the birthing parent's body,
Right.
triggering hormones, initiating supply, aiding physical recovery, even causing those uterine contractions. It just highlights how fundamentally connected the two of you are, driving this entire process together in those first few days.
That's such a powerful perspective. It's not just feeding, it's a dynamic dance almost, a co-creation.
Sure.
Hopefully, exploring all this information you shared helps you feel more informed, maybe a little less daunted, and ready to embrace this truly special, albeit demanding, time.